one lit cigarette generates about 7,000 toxic chemicals. 69 of these chemicals are known to cause cancer. Over 8 million humans die from smoking every year. Cigarette smoking is one of the leading preventable causes of death across the globe. Of the nearly 8 billion humans on Earth, over 1.2 billion are smokers. One person dies every 6 seconds from a tobacco-related disease. Tobacco is the main ingredient in cigarettes and contains natural alkaloids, such as nicotine, which is the primary addictive component. Over 600 different chemicals are added to cigarettes to enhance flavor, regulate burn rates, and improve nicotine delivery to the body. These additives contribute to the formation of thousands of harmful chemicals when burned. Smoking damages almost every organ in the human body. The tobacco is rolled in a cigarette paper to regulate burn rates. The cigarette filter is intended to reduce inhaled toxins. However, it still allows the passage of harmful gases. Arsenic, cadmium, polonium, benzene, and formaldehyde are some of the deadliest chemicals produced by burning tobacco. Formaldehyde is a toxic chemical used in the preservation of dead human bodies. These chemicals, along with many other toxic chemicals, causes many different cancers. When a human inhales smoke from a lit cigarette, the smoke begins to stain the entire mouth due to the presence of tar. Tar is a sticky dark substance. It is similar to the tar used in the construction of roads. The tar begins to stain the nails and teeth, and also coats the throat, gum, and tongue. Over time, the smoker develops severe gum disease and tooth decay. The tasting capabilities of the tongue is lost. In severe cases, the victim may develop oral cancer. While the tar destroys the buccal cavity, other chemicals in the smoke end up in the lungs. Within the lungs, tar works with another poisonous gas in the cigarette smoke called hydrogen cyanide to destroy the cilia in the lungs. Cilia are tiny hair-like structures which move simultaneously to clear mucus and dirt from the lungs. The paralysis of the cilia prevents the lungs from cleaning themselves. This leads to excessive buildup of mucus and dirt, which further cause chronic cough and frequent lung infection. Due to the destruction of the cilia, several toxic chemicals and gases manage to enter the alveoli. Alveoli are tiny air sacs within the lungs. There are approximately 600 million air sacs within the human lungs. The alveoli is where carbon dioxide is exchanged for oxygen. In this site, an oxygen-carrying protein in red blood cells called hemoglobin swaps carbon dioxide for oxygen. The hemoglobin then carries the oxygen to body tissues that require high levels of oxygen, such as the brain and the heart. Carbon monoxide is also a poisonous gas found in the cigarette smoke. When carbon monoxide is present in the alveoli, it competes with oxygen for binding spaces on the hemoglobin. During the gas exchange process, carbon monoxide rather binds to the hemoglobin, leaving the oxygen behind. The carbon monoxide becomes useless when it reaches the body tissues. As a result, the body experiences systemic hypoxia or oxygen deprivation, leading to cellular dysfunction and damage. Reduced oxygen supply also causes dry and saggy skin, leading to premature aging and wrinkles. This overall destruction of the lungs may cause lung cancer in future. Smoking is the leading cause of lung cancer. The carcinogens or cancer-causing chemicals in tobacco smoke damage the DNA of lung cells, leading to mutations that can result in uncontrolled cell growth and tumor formation. Lung cancer is particularly deadly as it is often diagnosed at an advanced stage when treatment options are limited. People who smoke are 20 times more likely to suffer from lung cancer than non-smokers. Cigarette smoking is strongly linked to cancers of the lung, mouth, throat, esophagus, pancreas, and bladder. Tobacco use, especially together with alcohol, is a major risk factor for head and neck cancer. About 72% of head and neck cancer cases are caused by a heavy use of both alcohol and tobacco. Smoking is also the leading cause of chronic obstructive pulmonary disease, a progressive disease that makes it difficult to breathe. Chronic obstructive pulmonary disease includes chronic bronchitis and emphysema. Emphysema occurs when cigarette smoke destroys the alveoli, the tiny air sacs in the lungs responsible for gas exchange. As a result, less oxygen reaches the bloodstream. Carbon monoxide also promotes thrombosis. This is the formation of blood clots which can block blood flow to vital organs. The lung damage caused by smoking is often permanent, leading to decreased lung function and an increased risk of death. Even if a smoker quits, some of the damage may be irreversible. However, quitting smoking can still significantly improve lung function over time and reduce the risk of further complications. Male and female smokers lose an average of 13.2 and 14.5 years of life, respectively. At least half of all lifelong smokers die earlier as a result of smoking. Nicotine, the psychoactive drug in tobacco, makes cigarettes highly addictive and very difficult to quit. Once nicotine hits the bloodstream, it reaches the brain within few seconds and promotes the release of chemicals such as dopamine. Dopamine promotes feelings of pleasure and relaxation. Smoking also increases the risk of heart attack, stroke, and hypertension. Nicotine constricts blood vessels, raising blood pressure and increasing the risk of hypertension. Smoking weakens bones and contributes to osteoporosis. This is a decrease in bone density, leading to weaker bones. Nicotine reduces the absorption of calcium and the production of bone-forming cells. Generally, smokers experience slower healing from fractures and surgeries. Many countries have restrictions on cigarette advertisements, promotion, sponsorship, and marketing. Some countries require cigarette packs to contain warnings about health implications. In some countries, it is a requirement that the tobacco warnings must cover 75% of the cigarette package. Tobacco smoking has been one of the largest health problems in the world for decades. The World Health Organization estimates that tobacco has killed about 100 million people over the course of the 20th century. Approximately 5.6 trillion cigarettes are smoked every year across the globe. Cigarette is considered to be the most hazardous consumer product in the history of the earth.